Hello students. Today I am going to discuss about some more clinical scenario based questions based on the shoulder region when you are reading the upper limb. So let's discuss these questions one by one. So this is the first question. Now see, the questions are very simple, but these are the clinical scenarios. So you have to find out the keyword from that scenario. Now what is the question? That question says is that there is a 28-year-old male fall on the shoulder and complains of difficulty lifting his arm sideways above 15 to 20 degree. Now, you know that when we are talking about the 0 to above head abduction, you have the different phases. So, which phase is here? It is above 15 degree. Now, on examination, there is a weakness in the shoulder abduction. Which of the following muscle is most likely affected? So, we know that the muscles which are initiating for the abduction is supraspinatus. Then it is taking to the 15 degree. Above the 15 degree, you have the muscle is the deltoid, and more than 90 degree, you will have the serratus anterior and trapezius. So because we are talking above the 20 degree, the answer should be the deltoid muscle. Clear? Now we'll move to the second question. A 30-year-old man complains of difficulty lifting the heavy weight sideways. Sideways means is again that he is not able to do like this movement. Now the deltoid muscle, which is multipinnate, allow for powerful contraction due to which of the following property? So see, this sideways word is given because it is saying that it is a powerful abductor. So you are able to take your upper limb above 15 degree. But the question is about the multipinnate property of this muscle. So which is the multipinnate property, quality of the multipinnate property? All fibers runs parallel to the tendon? I think no. Fibers are arranged obliquely on its central tendon. Single tendon insert with few fibers. Fibers runs longitudinal from the origin to insertion. No. Answer is B. Now, when you will see the arrangement, you have to keep this thing in mind that pinnate means the feather. So this is your central tendon, and fibers are inserting, they are coming like this. So there is a oblique direction of the fibers which are inserting on the tendon, which is making it multipinnate in appearance. Clear? Now we'll move to the next question. A patient sustains a fracture of the surgical neck of humerus. Now, which part is here highlighted? Surgical neck. Now, on examination, there is a weakness in the shoulder abduction and there is a loss of round contour of the shoulder. So, again, the muscle which is abductor is affected and there is a fracture of the surgical neck of humerus. So, which of the following nerve is most likely injured? Now, you know that the axillary nerve making a circle behind the surgical neck. So, what is the direct answer? Is the axillary nerve. Clear? Musculocutaneous is not having any relation. Radial nerve goes behind the humerus in spiral groove, and suprascapular is nothing to do with the humerus. So, answer is A. Now we'll move to the next question. A 28-year-old man has fractured. Again, the question is on the surgical neck. Now here the previous question and this question both are the same, but the pattern of the options has been changed. In the previous question, you have the direct name of the nerves. Here, you will have the name of your root values. So, on the examination, there is a weakness in shoulder abduction above 15 degree. So, surgical neck is there. That means the axillary nerve is damaged. Above 15 degree is not possible. That means the nerve supply of deltoid is hampered. So, which of the following nerve roots most likely involved? So, what is the nerve root of axillary nerve or root value of axillary nerve? So, that is a direct question. Answer is C5, C6. It is the root value of axillary nerve. Clear? Now, we'll move to the next question. A 35-year-old man has weakness in shoulder abduction above 15 degree. Now, this is again above 15 degree. That means again we are dealing with the deltoid muscle. Now, when there is a flattening of the deltoid contour and sensory loss over the lateral shoulder is there. So, there are two things are there in this question, that when you are talking about the axillary nerve. Axillary nerve is supplying the deltoid, which is responsible for the abduction above 15 degree. But along with that, the cutaneous branch of deltoid, which is known as upper lateral cutaneous nerve of the arm, which is supplying this area, it is also having the loss of sensation in the lateral part of the shoulder. That is known as regiment badge sign. So, which intermuscular space and its contents are most likely involved? So, now the question comes on the spaces around the scapula. So, you know there are three spaces: quadrangular, upper triangular, lower triangular. So, axillary nerve passes through which actually the space, and that is about the question. So, it is the quadrangular space. You know that quadrangular space is having four border. You will have the humerus on one side, you will have triceps long at one side, teres major below, and teres minor and shoulder joint above. So that is your option A, that is quadrangular space. Now the next question is, a 40-year-old man complains of pain in the shoulder and difficult initiating in the abduction of arm. Which of the following muscle is primarily responsible for first 15 degree? That means there is a difficulty in initiation. So I already told you it is a supraspinatus muscle which causes initiation of your abduction. Clear? So answer is B. Now the next question is, which of the following muscles are rotator cuff of the shoulder? So it is a direct question. You all know that there are four muscles which are inserting on the tubercles of humerus. So it is side, you will have greater tubercle, on the front you will have lesser tubercle, and there are four muscles: subscapularis, supraspinatus, infraspinatus, and teres minor. So directly if you will see, this is the deltoid one, so this is not the answer, this is not the answer, pectoral is not the answer. See here, supraspinatus, infraspinatus, teres minor, and subscapularis. Clear? Now we'll move to the next question. A patient with an injury on the rotator cuff. What is the main job of the rotator cuff muscles? So whenever you will have the rotator cuff, whenever we are talking about the action of the muscles of rotator cuff, they are basically providing support to the shoulder joint. So what should be the answer? It stabilizes the shoulder joint from above. Clear? Now we'll move to the next question. A 35-year-old man presents with the pain and tenderness around the region of shoulder. On examination, when arm is abducted and pressure applied causes no tenderness, this clinical sign is known as. What does it mean? That when a person is having this neutral position and when you are palpating, patient is having pain and tenderness in the region of shoulder. But now in the next step, when you are asking the person to do the abduction and now you are applying the pressure at the same point, patient is not having the pain. Why? Because dear students, there is a bursa which is known as subacromial bursa. So initially when you are in the relaxed position, the tenderness is there, but as you will do the abduction, that bursa will go deep to the acromial process, and now when you are pressing this, it is not you are not able to irritate that bursa because now it is protected by the acromial process of the scapula. So that is known as Daubren sign, which is a classical sign seen into the bursitis, clear, of this subacromial region. Now we'll move to the last question of this session. A 45-year-old man felt a sudden snap in his arm. Sudden snap in his arm means there is a sound of some thing which is ruptured is there actually. So sudden rupturing sound is giving the snap sound into the arm while he is lifting a heavy object. Now soon after he noticed there is a bulge in the anterior aspect of his arm when flexing the elbow. Which of the following muscle is most likely involved in this Popeye's deformity? Now see, what is actually this is question about? It is about the rupture of the tendon of biceps. So when this tendon of biceps will get ruptured, this biceps muscle will get collected, and this collected belly of the biceps will bulge out like a cartoon character, that is Popeye. So because of this cartoon character, the word Popeye deformity comes, where the biceps belly is collected into the front of arm. So it is a classical sign seen into the injury of biceps brachii tendon. Clear? So these are the questions from today's session. I tried to discuss the 10 important clinical scenarios, and you have to find out the main keyword from these questions during the attempt. So this is all for the session. Thank you and bye bye.